Hi everyone and welcome. Introducing B. B is a midwife and a PT, and she has got an amazing program called Core and Floor Restore that we're talking about today. She's also, if you have, maybe you've seen her in the earlier modules talking about her Core and Floor pregnancy course. So they're kind of, there's a lot of similarities in them, but B's going to talk about, why this one for that post-birth stage is so important, and also give you a little rundown of her history and how she sort of got into this specialization. So thank you, B.
Hi, thanks, Emma. So long story short, I basically had incontinence from when I was 19, and that progressed throughout my 20s. Preconceptionally, I really wanted to get on top of it because I knew that my pelvic floor would be affected by pregnancy, and I knew my pelvic floor was really a crucial muscle, not just in pregnancy, but in labour and birth. So I was planning to have a home birth through private midwives in Melbourne, and I wanted to do everything possible to enable my pregnancy, labour and birth and postnatal experience to be as healthy and as efficient and effective as possible. So I went and saw a physio about 6 months before I conceived my son, and was told to do my Kegels, stop running, and don't get pregnant for 4 months. So I followed her advice, and none of us do our Kegels as much as we were told to do, so I didn't do them as well, but I definitely got on top of it. As you're doing that preconception period, especially prior to your first baby, second time around doesn't kind of exist, but first time, you're onto everything. And so I did do them more than I had been doing them. Became pregnant 6 months later, and suffered really badly from vomiting, and from 6 weeks. And it was kind of cute. The first day it was like, oh, I vomited, how awesome. And then like 2 weeks, yay, pregnant, this is it's worked. And then 2 weeks later was wearing incontinence pads. And if you watch the first video, I went on about how they're so big and chunky and uncomfortable. And when you leak urine, you really feel like you're wearing this bright, flashing neon sign that says, I just wet my pants. And you feel like the whole world can see it. And it's extremely debilitating. And my mental health was the worst it's ever been. And my physical health was being affected because I was too scared to do anything. And that cycle just evolves. And so by 18 weeks, I spent a lot of time, I was a publicly funded home birth midwife through a big hospital in Melbourne. So I spent a lot of time at women's houses, and I spent a lot of time driving. And when you're stuck in traffic in Melbourne, I couldn't go anywhere without a change of clothes because I would vomit. I never went anywhere without vomit bags, but I was just covered in urine and vomit the whole time. I'd be sitting in my car in traffic and I would have wet myself. And it's the most disempowering event.
Awful, so awful.
To be, and I was running marathons before this. I never leaked urine when I ran, but I was this fit, healthy, intelligent young woman, and I felt like I was a shriveled up old person that just couldn't function. And then I was like, well, how am I going to give birth?
Pregnancy because of that experience, because of
it was
physical, not feeling
and
empowered, and like you want to feel when you're growing a baby.
Yeah, and I've told this story a lot, and through that I've probably healed because I've debriefed a lot. But my son's just turned 3, and it probably took me a good 2.5 years to not be able to swell up, like, cry and
not tell the story.
Not cry, yeah. And now I'm kind of really proud that was proud of that experience, or not proud. I'm grateful that it existed because now I have created this, and through it. Because, incontinence is something that we laugh about. Oh, we know that 1 in 3 women leak urine post-birth. It's a stat that's really well known. And, there's these memes about peasing and, where you sneeze and wet yourself. And whilst humor, and I try and use humor too, because it is a really boring topic typically. So I try and make it fun and, interesting. But we laugh about it, but no one talks about the fact that you can heal. And issues, there's so much more in the postnatal period besides wetting yourself. There's, 1 in 5 women are experience fecal incontinence. So where
Yeah,
you
wow,
leak
I didn't know that.
poo.
It's huge.
At 1 year post-birth, 1 in 5. 1 in 3 are incontinent. 50% of women that have given birth have a prolapse.
Yeah.
So there's 2 of us right now. That's one of us. It's 50%. And most of it is asymptomatic post-birth. So that means you're not experiencing symptoms. But so many women just think, oh, that's what my vagina feels like now. And I remember post-birth looking down at my body and being like, sorry, this isn't my body. Like, what's happened to it? This isn't what I went in. Yeah, like, whose vagina is that? That's not my vagina. Where did my vagina go? And I didn't tear. I was intact. And it just looked different. It felt different. And so many women go, oh, well, I've given birth, so that's just it now. And that was
different, never going to be the same. It's like it's just part of giving birth is having post injuries and changes, and
the most favorite thing about me doing this, that doesn't even make sense. The best thing
I think I know what
that I love, you know what I mean? My favorite thing is that women are like, I've not only healed, I'm now stronger.
Yeah.
And I'm stronger than I ever was. I'm stronger than I was preconceptionally.
Yeah.
And that's huge. And women need to know that. Women need to know that they can heal. Like, you've grown a whole other human being.
Yeah.
Your body is totally capable of healing.
Yeah.
But it takes time, and it takes patience, and it takes work. And so often women with conditions like diastasis recti go and get surgery, or even, the women put up with it their whole lives. They put up with that bulging, that heaviness in their vagina. They put up with not being able to turn the key in their front door and get into their house without feeling like they're going to wet themselves forever. And then they get into their 60s and 70s and they go and get a surgery. Now, so many of those surgeries, I think it's 67% have to be redone within the first year of getting into that pelvic floor mesh.
That's not an effective or a good outcome. Like, that's like that's
it just shows that we're not exercising and moving right. And so much of healing is learning about how to correctly activate your pelvic floor and your core so that you move right throughout your day and you exercise right. So there's no point doing 10 minutes of Kegels if you then go to the gym and push against your pelvic floor, which is what you do when you suck your belly button into your spine. So women think they're activating their core because they pull their belly button in, but in that force, when you do it on an inhale, you push down on the pelvic floor. So
so these
basically,
are all the things that are in the program, is teaching you how to activate the muscles properly, how to strengthen them in the right time frames. I think that's such a huge thing, the fact that you can heal some of these injuries that women don't get told that, it's like that same thing. It's like you don't have that. If you don't have that knowledge, how would you think? You just think that your only option is going to be to have surgery when it gets so bad that's your that's the only thing. You're like, oh well, that. And that I've known plenty of women that's friends, and that's happened to as well. So it's so awesome to have this tool to be able to give to mum so that they can avoid those sort of really to heal and to empower and to get back to better than they were before, which is incredible.
Yeah, and just to know about it. Like, so many women are like, I had no idea I had that. Now what do I do? And, like, oh, that's what I've been experiencing for the last 6 years. And, so many women suffer in silence. And I think, as traumatic as my experience was, it's enabled so many conversations and so many women to go, okay, I can do this. If you did it, I can do it too. And that's the thing, because we've all got the same makeup in terms of our how our bodies are put together. So it's the same principles that help us to all heal. And it's that encouragement and knowledge that other women have done it and gone through it, so I can too. And it's the same thing around birth. We share so many negative stories. 1 in 3 women experience birth trauma. Now, if there's trauma there, you're not going to connect to those muscles properly. So trying to prevent that trauma in the first place and trying to build that strength and positive mindset that you can do it, and then knowing how to heal from it so that you can heal physically and mentally. And that's a big part of my program too. It's like, okay, what is stopping, if you're not healing and it's not working for you, what's actually stopping it? And a lot of the time it's that it's that mental health behind it.
Yeah, and maybe potentially that traumatic experience, and then what that creates, and that sort of disempowered mum, like that's a huge part of it. So obviously these courses are online courses, but you also have that one-on-one contact with anyone going through the program as well, that they can get questions answered about what and you might go through their history and what's happened and what was their birth experience and those kind of things.
Yeah, there's heaps of bonus videos that go through all of that, but I want you to succeed. I want you to heal like I have. And so I'm here the whole time, and it does make it so much better when people contact and ask questions, and know that I'm there for them. Like, that's often what I get. Like, I had the confidence to keep going, because often you will get stuck, or you will, you'll start the program and things will come up. You'll have sleep deprivation and stuff like that, and then you'll get back into it. And it's that confidence and reassurance and support to keep going that I really try and put in the program. So yeah, basically the program came about from my own experiences of incontinence, and then having an amazing birth and going, all right, I can do this, I can heal, and then doing a whole lot of research in this area. So I love research. I'm an academic myself. I've a published author. And so I looked at the research, and there's not a lot out there, to be honest. It's a really, if men were leaking urine at the rate that women were, we would have been on top of this decades ago. But it's not addressed. It's not like all women need to see a women's health physio post-birth. That should be part of our routine postnatal care that's provided by public health.
Does that happen in hospitals? Because I remember when I had my babies, a women's physio coming and seeing me before I went home. That was 20 years ago.
Yeah, but that's not the time. You really want to see one around 6 weeks. When your body's just given birth, you need to really see one once you've stopped bleeding, because that's when you can have an internal assessment. So we don't do internal assessments while you're bleeding, and you haven't hit like.
I certainly didn't have an internal. I just remember them. I think it was just make sure you do your Kegels, basically.
Yeah, which is what I was told, and that led me to being incontinent horrendously all day, and that was why I was incontinent. And there's so much more to healing than doing your Kegels, and that's what a lot of and a lot of physios in hospitals aren't women's health trained, especially in rural and remote areas. So they're not, they're doing their best, but and the women's health, some people who have women's health physio training, it's a couple of days workshop. It's not
necessarily
a huge in-depth
big for this kind of
the
healing post-birth. It's just general sort of women's health physio stuff, not really this.
So some hospitals, like the bigger hospitals and city hospitals, will have amazing physios, but really you want to source one. In today's day and age, you can do telehealth. So whilst you can't have an internal examination via telehealth, there's a lot of things that they can talk to you about. And so
clinical kind of signs and symptoms that are going on in your body that you can report.
And they're the people that should be diagnosing you, not GPs or obstetricians. Physio health, women's health physiotherapists they're the ones you want to see around prolapse and incontinence.
Are they easy enough to access for mums? Would it just be that trying to Google and find one in your area, or find how do you know who's a good one?
Yeah, it's really hard, because I did research. I went through a really well-respected foundation, and I didn't feel like I got good care. It's like anything, isn't it? It's really hard to find someone that's right for you and knowledgeable in what you're experiencing. I mean, the world of Instagram is great these days. You can really find people out there that are knowledgeable, and there's so much free information. But I get a lot, and that's why I created this course as well, so that women had that information and education, so that if they couldn't access somebody, they at least had tools to be able to help themselves. Because whilst your care should be individualized, it's really hard and expensive to get that. And because it's not part of our public health system, and $90 or whatever it is a visit is really hard post-birth when you're not earning, you might be down to one income family, or not even that. Especially in the current climate.
one of the things I love about your program is how affordable it is as well, and how accessible, and, you know, like, and that you can certainly do it at any stage of pregnancy. The pregnancy program, you can actually buy the two programs together for a really reasonable price. What was the price of the two programs?
It's $149 for both. And like, I'd love to be able to recover the money that I've spent on it, but I'm not doing it to make money on it.
Yeah.
I'm doing it because I want women to have this knowledge, and I want women to be able to walk down the street without the fear of wetting themselves, or be able to lift their babies up without feeling like everything's going to fall out, or wake up in the morning without a sore back. Because that's the biggest thing with core. Like, most of us don't know how to connect to our core. We don't even know what it makes up. We just think about the six pack. And we don't know how to move throughout our day. And, you know, in pregnancy, you're carrying around this extra weight that has stretched you. Your heart even has to move out of the way to be able to accommodate your growing babe. And then post-birth, like, when else in our lives do we walk around with this 4, 5, 6, 7, 8, 9, 10 kilo weight? And it gets heavier and heavier, and we are picking it up all day long. And then when you're a mum at home, all of a sudden everything's on the floor. You're on the floor, you're getting up off the floor, you're picking, you know, clothes, toys all day, every day, and you're working against your body. And so you're not only not healing, you're making it worse. And so it's true. Yeah, and that's the biggest part, that when women do my course, they're like, I'm now moving properly. And when I move, I protect my core and floor. And so what I want is people to do this course and then apply it to life and exercise. Yeah. So I've had, you know, surfers do it. I've had CrossFit people do it. I've had people lifting weights. And yes, it's slow. So people that do high intensity kind of come to it and they have to reshift their mind a little bit, but it's a foundation. It's learning the skills and techniques that you then can apply to any exercise and get back to doing what you love even stronger. And, you know, gaining that confidence in how your body works, looks, and feels, because that's a big thing. And we try and talk about body positivity all the time. And I'm a big one for loving your body. But if you don't love your body, then you need to do something about it. Yeah. You know, it doesn't matter how many people tell you that big is beautiful and all those things. But if the truth is that you don't wake up happy in yourself, then we need to do something about that.
Yeah, absolutely. And it is, like you say, it's that foundation and the building blocks of then being able to do any kind of movement or any kind of exercise well, or just moving through the world well, and picking up the stuff off the floor, and, you know, like all of the benefits that you get from that. And then that also goes into healthy aging, doesn't it? Because incontinence is such a accepted part of aging, you know, like that's just
the second most common reason that women or people are admitted into nursing homes. The second most common reason. And so I have a lot of women in their 60s and 70s that come to me, and I'm sorry if you're watching this and you're in your 30s and 40s, but they do so much better because they are so driven. Because they're scared. They are near that point of being admitted into an aged care facility, and they don't want to go there. Yeah. And so they are driven. They also don't have a toddler tugging at them and jumping on them when they're trying to exercise.
So they can actually do that. But a lot of your stuff is only sort of 10, 15 minutes a day, isn't it? Once you've got through the program, to keep up those positive changes and the strength in that core and floor, is there's only a little bit each day, but you do it each day, and then you just keep getting stronger and you don't go back. Yeah.
And so you can use my program once you finish it as a nice little warm up before you go for a run. It's because core and floor is for life. Yeah. And so it's about, like, I'm a busy mum and I want to be able to work on my body quickly but effectively. And so that was the whole idea of designing it with short programs. If you've got the time, you can do it as a circuit, or you can do 2 or 3 videos together. Yeah. But I don't have 2 hours I used to spend preconceptionally exercising anymore, and I don't have that mental space or the space in my home because my toddler's always there. Yeah. So it's designed to do that. But those women in their 60s and 70s, they know the reality, and women that have had more than one baby know it too. Yeah, they really you know, the more pregnancies you add, and if this is your first baby and you're watching this, get onto it now. Get onto healing now, because it will benefit your next pregnancy and postnatal recovery. If you don't get onto it and then you just keep adding pregnancies and postnatal periods to that, your body gets
You do worse
absolutely
each time,
smashed.
don't you? You just
Yeah, well, it has to stretch. And so
yeah,
every time it stretches, if you don't bring it back, you stretch, it comes back here, it stretches further the next
yeah,
time.
yeah,
And that leads to injury.
yeah.
So yeah, the stats are huge. The recovery is not 6 weeks. 6 weeks, nothing magically falls back into
Yeah.
place by 6
Oh, it's
weeks.
6 weeks, right? Time. Oh, everything's
Yeah.
thing. Yeah. And then,
Yeah.
like you say, if you're not doing the work to assist it, you actually could be doing the work to make it worse. Like if you're not
Yeah.
moving well properly, or if you're even getting up and down and all of those things with an injury, that is actually prolonging or worsening the injury because you haven't started doing these, using these tools.
Yeah. And you may not have an injury, but then you get
You'll
one
get one.
because you're
Yeah.
constantly working against those muscles. And so, yeah, obviously, the whole idea of the pregnancy program is that prevention, but the postnatal program is also prevention, because you may have come out of labor and birth physically really well, but it doesn't mean you're going to continue in your life that way. And so 1 in 3 women, that's huge statistics.
Yeah.
And 50% of women with prolapse, a lot of them don't feel the symptoms until their second pregnancy,
Yeah, that's so full
and
on.
post-birth.
I had no idea it was that much. Like, that's crazy.
Yeah.
Yeah.
And 100% of women experience abdominal separation. So that's a normal life event. Your body has to stretch in pregnancy to be able to accommodate baby. It's a normal function of the body.
Yeah.
Diastasis recti is the injury. It's
That's
where
the muscles come apart, right?
Yeah, so we're talking about the 6-pack,
Yeah.
and you've got this connective tissue, and I like to think of it as blue tack. And before you've had a baby, and not always before, because I have a program for men too, and I'm seeing a lot of really fit men that have just been exercising wrong, and they've got diastasis. So diastasis recti can be experienced by people who have not been pregnant, but pregnancy is the biggest risk factor, and heavy lifting is the biggest risk factor. So what I often see is really fit pregnant women with the worst damage post-birth, because they've continued to exercise in their pregnancy and they've strained that connective tissue. They've weakened it through that.
So that it didn't cope as well through the late stages of pregnancy and labor. And
so a lot of focus around diastasis recti is the width, but that's not the correct measurement. It's actually the depth. So what we're assessing is the integrity of that connective tissue. And so trying to heal that is a really, really big thing. And so women that have, often I see really fit women because they've constantly strained that. So 100% of women in pregnancy will have that abdominal separation, and it doesn't heal on its own, diastasis recti. So it takes around 6 months to bring that connective tissue back. So that's a long time of lifting and moving with a weight. And that's when that injury can often occur because you haven't been moving properly. And it doesn't then just heal on its own. You have to be able to do specific core work to get there. And
it's so important. I'm like, the nutritionist in me goes, oh, we need to be doing collagen as well, and like bone broths and these kind of things, like connective tissue. I just think the nutrition stuff, but that's why I love to have, people like you contributing to the program, because we're covering all the bases and getting the, the best,
and it's
the best outcomes and the best experiences. It's awesome.
It's such a holistic thing, healing. It's not just I do my Kegels and my pelvic floor gets stronger. It encompasses everything, and that's a really hard thing to do post-birth. So I think too, it's about being kind to yourself and acknowledging that it might take a lot longer than you want it to, but you will get there.
Yeah, awesome. Well, thank you so much, because I'm a huge fan of your program. I think it's so cool, and it's just, and that awareness of that capacity to heal and to really get the best outcomes and to heal the quickest, and just be empowered and prepared, and like having all of those great experiences, and that how important, we talk about this all the time, and I talk about this with everyone, is how important the birth experience is, and the more prepared and empowered we are, the more likely we are to have that awesome experience that sets us up for our mothering and our womaning. Like it's so important to how we feel about ourselves, and and that just gets disregarded. Like we always hear that, all that really matters is the baby comes out healthy, and then they're like, that's actually not all that matters, because that's just one tiny part of it. Like it's a super important part, obviously, but that mum experience and the birth experience then just relates to so many more of those other experiences that are to come.
And what's a healthy what's a healthy baby without a healthy mum?
Exactly.
Good. And the biggest part is mental health, and that your physical health affects your mental health more than anything else. So, you know, we need to decrease that birth trauma and decrease our, you know, postnatal depression and PTSD rates. And all of it comes from enabling women to feel empowered.
Yeah, absolutely. And that's such an awesome thing to finish on, because that is the whole intention of this program. So thank you so much. All of Bee's contact details and the courses and everything are in your resources section of this module. So
please get in touch.
Follow her on Instagram. Her stories are amazing and humorous, entertaining, and full of amazing content. So thank you. And I will.
Thanks, Emma.
Okay.
Thanks so much.